A pleasant good day, everyone, and welcome to the live broadcast on the dengue situation in Saint Lucia. I am Fennel Neptune. This broadcast is live via the National Television Network NTN and streamed on the Government of Saint Lucia's Facebook page. Today, we'll be discussing the dengue situation, and with us is the National Epidemiologist, Dr. Michel Fassois, and also the Chief Environmental Health Officer, Mr. Paco Ragnanan. Welcome. First of all, we'll have Dr. Fassois, who will give us an epidemiological overview as it relates to the dengue situation.
So dengue fever is an arboviral illness. It is caused by a virus, which is transmitted through the bite of the female Aedes aegypti and to a lesser extent the Aedes albopictus. Normally, 1 in 4 persons manifest signs and symptoms. So it's normally a relatively benign illness, which people recover very quickly from. However, you do have cases where persons may progress to a more severe form of the illness. The dengue fever, it's endemic in Saint Lucia, which means it is something that we see in Saint Lucia all year round, and we have recorded cases throughout the years. Certain years we see higher numbers than others, and that really depends on what's around us. So as it stands, in some of our French neighboring islands, there are outbreaks, and so we have been monitoring this and keeping an eye on what has been happening. In the French islands, they have recorded types 1, 2, and 3. In St. Lucia, however, we have recorded types 2 and 3. So there are 4 serotypes of dengue, type 1, 2, 3, and 4. And normally when you get one type of dengue, you are predisposed to a more severe form. So that one type, you get lifelong immunity to it, but not to the other 3. So for example, if I get dengue serotype 1, I am immune to it for the rest of my life. However, if I do happen to get a type 2, a type 3, a type 4, with each progressive infection, I am more at risk of developing a more severe form of the illness. And this is why with the circulation of 2 serotypes in St. Lucia, as well as the 1, 2, and 3 in our nearby countries, we are very vigilant and very concerned about this. So in terms of dengue, you have dengue without warning signs, you have dengue with warning signs, and you also have severe dengue. Now, in the dengue without warning signs, you have a very mild, as I explained, very mild signs and symptoms. It may start as a fever with very non-specific signs and symptoms. And something like this we monitor at the epidemiology department and under the syndromic, where we call it undifferentiated fever, because the signs and symptoms are very vague. You present with the fever, but because you also have headache and muscle and joint pains, which is quite similar to the flu, and now that we have COVID in circulation, we monitor the trends in that, and it usually coincides. So when we normally have an increase in undifferentiated fever in the unit, it normally corresponds to an increase in our dengue or our chikungunya, or we had the latest, the Zika. So with warning signs now, dengue would present persons with more diarrhea, abdominal pain, and you may get mild bleeding from the gums or the mucosa. But in the more severe dengue is where you person enter into shock due to continuous diarrhea or vomiting, and that is the most critical form where persons need to be hospitalized and monitored very closely. Through the years, we have, as I indicated, we have seen type 2 and 3. This year, we have seen type 2 and 3 this year, and we have noted that the age group in which we see it are mainly children, the 5 to 15-year age group. And we continue to monitor it because obviously children, especially if you have younger children who cannot communicate to you what is happening with them, it may be the diagnosis may be a little more difficult based on the presentation. We have not seen any significant variation in the sexes. What we have noticed, however, is in certain areas we have noticed an increase in the number of cases. So it's more in the north, although we have recorded cases in different parts of the island, but it's concentrated mainly in the north of the island. So we see in areas like Radwe and in the Grosile region, in the Castries region, we have recorded cases of dengue. But we continue to monitor and we continue to work with the public, and my colleague, Mr. Ragnana, will speak to more of the measures that persons can put in place to ensure that we do not have continuous transmission of dengue.
Thank you so much. Now we're going to have Mr. Parker Ragnanan, who will speak on the interventions by the Environmental Health Division and what are some of the initiatives that they are hoping that the members of the public will actually undertake.
Well, thank you very much. Before I actually go into the intervention, with your permission, I'd like to speak a little bit about the vector itself, the mosquito vector, because I think it's important for us to know what it is that we are talking about. When it comes to the spread of dengue fever, of great importance to us in Saint Lucia is the mosquito. There are several mosquito species. However, the species responsible for the transmission of dengue fever is the Aedes aegypti mosquito. In some instances, you also have the Aedes albopictus that can transmit the disease. Now, it's important for us to understand a little bit about that particular mosquito because it presents its own unique methods of feeding. The Aedes aegypti mosquito is really called a domesticated mosquito. And as such, it likes to live close to human habitats. So that is the species that you're going to find in and around the homes. The life cycle of a mosquito is basically between 5 and 7 days. We need to understand that because it's important for us to see how the life cycle of the mosquito really translates itself. A mosquito goes through 4 stages. In stage 1, we have the egg, which molds into a larva, and the larva into a pupa, and then you have the adult mosquito. This process takes between 5 and 7 days, depending on the conditions. The Aedes aegypti mosquito is unique in that it is the mosquito that has the stripes on the wings, the white stripes on the wings and on the legs. And their feeding habit is one where they generally come out early in the morning. We call that at dawn, early in the morning, or at dusk as the sun is setting. That is the time they come out to feed. They are not the ones that sing in your ears all night. That's a different mosquito. So the Aedes aegypti mosquito, its feeding habit is generally at dusk and dawn, and they like to bite around the ankle area. They like dark places. So it's important for us to first understand that there are different species of mosquito, but of concern is the Aedes aegypti mosquito. Now that being said, we need to look at interventions. What can be done to deal with that mosquito? Because it is a domesticated mosquito and lives in and around our homes, it means that we have to begin to determine where exactly these mosquitoes breed. And I'll tell you where they breed. They are not the ones that like the dirty water in the pools. That's a different type of mosquito. The Aedes aegypti mosquito likes clear, clean water that is stagnant. It is standing somewhere. So they usually are around stagnated water in containers. And what are the containers that we're talking about? The drums. Now we know that many times in Saint Lucia, there are problems with the consistency of the water supply. Therefore, persons are generally forced to collect water. The problem is not collecting water. The issue is when water is collected and is left uncovered. It means that the adult mosquito has access to that water. Where it lays its egg is not directly on top of the water, but just above the surface of that water. Mm-hmm. So when that egg now hatches and becomes a larva, then you get the larva. People call it worms and wrigglers. Mm-hmm. They see them in the drums. This is where it gets into the water. So they're just above the line of the water. The eggs are laid. So they need to get water for laying their eggs. Similarly, before they lay their eggs, they need a blood meal. And the blood meal, and I'm sure Saint Lucia would know by now that it is only the female mosquitoes that bite, because they need a blood meal in order to reproduce, in order to lay their eggs. That is why we as human beings are targets. We actually feed the mosquitoes the blood meal. That is why they live very close to us. So the water drums are generally left uncovered, and therefore the adult mosquito has access to laying their eggs in the drum. And that egg now goes through the cycle and would in 7 days become an adult. Same thing happens for other water containers. We've seen stoppers, bottle caps. Once it can get enough water, mosquitoes would breed there. So big items like the drum that collects water, small items like the bottle caps that collect the water, they both attract the mosquitoes. In between, you have small items, used tires. And we know that it's an issue disposing used tires properly. But these tires many times collect water, and that is a fun place for mosquitoes. They get access to the water in the tires, and there they are having fun. The flower pots, many persons still use water in the pots. And once a mosquito can get to that water, they lay there and they'll breed. And many times we do not take a look at these flower pots to change the water regularly. And that is a problem. We've seen the roofing, the gutterings of the house. Sometimes you have sagging and water collects in these. Mosquitoes would also breed inside of there, as strangely as it would seem. Sometimes the septic tank, which is supposed to be airtight and watertight, that means air and water should not go in and out of that tank. Sometimes you have little cracks and breaks in that septic tank. And once the mosquito get access to that, they'll breed in there. So there are hosts of areas in and around the homes that mosquitoes choose as their habitat, their area for breeding. And so we have to be very aware and cognizant of these breeding places. So I've mentioned drums and so forth. But what about other bulk waste items? Old refrigerators and old stoves and these kinds of equipment that people no longer have use for, and they store it sometimes on the side of the house, in the backyard somewhere. These too collect water, and they also create a harboring place, a breeding place for mosquitoes. So you ask specifically, what are some of the interventions that the Department of Environmental Health has taken? Over the years, we have continued to work with communities. Because I want to say again that the Environmental Health Department, the Ministry of Health, no one ministry can deal with the mosquito problem in Saint Lucia. Dealing with mosquitoes requires what we call an integrated vector management approach. It means that we all have to be on board. So the question is not just what has the Environmental Health Department done, but what are we doing as a nation to control the breeding of mosquitoes and the spread of vector-borne diseases. But I tell you, some of the things that we continue to do, and people still rely for us to come and put things in the water. So we go from house to house, and when we see breeding in water containers, we would put a larvicide to kill the wrigglers in there. We would speak to the householders and educate them and tell them they need to cover the water containers. There are times that you would see the black smoke at nights, and some people complain that they can't stay in their homes, they have asthma, they have other respiratory conditions, and yet we're getting a large cry throughout the whole island. We want to see the fogging operations. What exactly does fogging do? Fogging is one of the treatment measures that are implemented to kill the adult mosquito. But if that adult has laid eggs already, the eggs will not die. The larva will not die. The pupa that is in the water drum will not die. And so you might pass around and fog the area, kill the adult mosquito, but in 2 days' time, you have new kids on the block. New adult mosquitoes are formed. So it's not very effective. It's not very effective. And plus, it makes it extremely difficult to sustain that kind of approach. There's no way that fogging can be done in any community every other night. It just cannot happen. It is too costly, it is too expensive, and clearly the ministry do not have the resources to allow for that. However, that is an intervention that we would use when there is a need to use it. We continue to work with the schools and the other organizations, churches, community groups, in doing sensitization and education. For this year, we've had a number of what we call cleanup campaigns, where we've gone into communities like New Village and Pave, to name a few, where we've worked with these communities and we've seen a number of items removed and disposed of properly. These are great initiatives. They are also expensive and time-consuming. However, we'll continue to do our source reduction exercise. We are now in the process of putting out some media presentation because we are hoping that every household in Saint Lucia would know how to inspect in and around their homes for mosquitoes, what it is that you need to look for, and when you find a problem, how do you deal with this problem? So we are going to be putting out little PSAs through the radio, through the television, through the social media platforms, informing householders how to conduct an inspection of their premises. That is important because you need to know how to inspect your homes. And when you find breeding, how do you deal with the breeding problems? We continue to work with organizations. And COVID has made it very difficult for us to sustain our work with organizations because a number of groups and sporting organizations have become inactive as a result of COVID-19. That means the groups do not meet as regularly as they met, and it becomes difficult when you have to meet persons on Zoom and other platforms and not be able to have a face-to-face town hall kind of meeting with them. And you actually need people to go out into the community to do the work. And that is something that is a challenge. Even our own vector control officers were being turned away by householders. They weren't prepared to accept our officers. And so we want to appeal to all of Saint Lucia that when the vector control officers come to your premises, do as much as you can to facilitate them and to make arrangements so that they can get into your yard and onto your property, be able to do a proper inspection so that we can know exactly what is on the ground, whether there is breeding or not, and what measures can be taken to deal with the breeding. So we continue to do adulticiding, that is fogging. We continue to do larviciding, and that is where we put the chemical in the water to kill the larvae for the mosquito. These are some of the initiatives that have been taken and we continue to take to deal with the mosquito situation on the island.
Thank you so much, Mr. Ragnanan. Before we go back to Dr. Faswa, perhaps if you could tell us, do you think it is necessary that persons actually inspect around the household daily or weekly?
Given that the life cycle of a mosquito is 7 days, we would like to see it at least twice a week. You do that inspection. It is important that you know what to look for and where to look for them. The issue is, when it comes to mosquito control, we must be our brother's keeper. So all of us must work together as one community. And that is why the appeal is always, what can you do? What can your neighbor do? And what it is your community as a whole can do. Because very often, what we find is one household is doing all that it can in taking the preventative measures. But 2 houses away from you, nobody cares. And mosquitoes have a reasonably long flight range. They can travel up to a mile depending on the wind direction and wind speed. So that means if you are to look at a safe zone, you need to look at a 1 mile perimeter from where you live. Because it means that if somebody has dengue fever and they're living half a mile from where I live, it is possible that a mosquito can bite that person, get infected, and when that mosquito gets infected, we say technically the mosquito becomes infective. And when you have an infective mosquito, it can fly from half a mile to another person that distance and bite that person, and that person can get the dengue fever as a result. So very importantly is we all must do our part. Every householder, your neighbor, your community as a whole. What are the things that we are talking about when it comes to inspections? One is we need to look at the containers that can hold water. So we've spoken about some of these containers already. You need to look at these containers. Secondly, we need to pay attention to the way that we dispose waste. You know, yesterday I was with my brother and I drank a coconut. And he had to remind me that whenever you drink a coconut, you have to cut it in two. He says that's natural for the coconuts, right? And that is important because not only do you cut the coconut, the jelly coconut that you have drunk in two, but you must turn it face down so that you're not creating any atmosphere, any condition for breeding of mosquitoes. So these are the simple things. Sometimes we overlook, you drink a coconut and you just throw the empty coconut shell away. You must be very careful in terms of that. So we need to look at the breeding areas. We need to look at the disposal of solid waste. And that is very important. Whether it's big waste items or small waste items, they are all very, very important. You need to be able to inspect your roof gutterings, inspect your septic tanks, look at your flower pots. These are all important areas to look for to see whether there's breeding or not. The issue of adequate and proper waste management is not just for dealing with mosquitoes, but it deals with other vectors as well. Because rats also like to live in the rubble area, in the dirty area. How do we dispose waste foods? Because they can attract other vectors onto our properties. So all of that must be taken into consideration. And therefore, when we are inspecting our houses, our premises basically, it should be done at least twice a week, as I've said, but everybody in the community must work together in order to reduce the breeding of mosquitoes and ultimately the mosquito population. Now, if you allow me, Ms. Neptune, I want to say one thing. Over the years, we've been doing house-to-house inspections and going from one community to the next. And we've seen that there is a high population of mosquitoes throughout Saint Lucia. As a matter of fact, as we speak today, the average index of mosquitoes is 25%. So that's a very high index. The World Health Organization says if you have a mosquito index of anything above 5%, you are at high risk of having a mosquito-borne disease. Currently, the national statistic is about 25%. But it doesn't end there. The data also shows that there are certain hotspots in Saint Lucia. We have certain communities that the index is as high as 66 and 67%. Oh. That is extremely high. And therefore, it is important for every one of us in Saint Lucia to play our part, to do our little bit in order to reduce these mosquitoes. Because let me tell you, it's true. The mosquito can carry diseases, and these diseases can be fatal. And we need to be aware of that. And today we're talking about dengue fever. There are many of us who have had the experience. A few years ago, it was chikungunya, and people still today are able to tell me about their experiences of chikungunya. And they still tell me when they wake up in the morning at times, they can't straighten their fingers, they still have the pain. Years ago, we saw the Zika. It's the same mosquito, the same Aedes aegypti mosquito that transmits dengue fever. And it's at our doorsteps now, and we need to be very proactive in order to prevent deaths and to prevent our family members from getting sick and getting dengue fever.
Thank you so much. For Dr. Persuade's question is, what is the more vulnerable population for the different serotypes of dengue?
Well, there is really no more vulnerable population per se. The dengue fever affects children as much as it affects adults. What we have noticed is that of cases to date, the 104 cases that we have recorded to date, we have had more children being affected by dengue fever. And whilst we noticed that we've had an increase in the number of cases compared to previous years, we noticed that a lot of these cases, it really spiked during the weeks 27, 28, which is mid-July, and to date, the numbers have come down. So being that our children and our older population are the more vulnerable to most diseases, it really is important that we pay close attention and monitor for signs and symptoms and do the necessary in terms of getting the help or seeking medical assistance if we do have signs and symptoms. We are testing on island. We do antibody testing. We also do antigen testing on island in Saint Lucia. Serotyping, however, for us to determine whether it's type 1, 2, 3, or 4. This is sent to the Caribbean Public Health Agency. But we do have the capacity to test in Saint Lucia to get rapid results. So if persons do have signs and symptoms, you do present with the pain to the back of your eyes, the fever, the muscle and joint pains, we do ask persons to seek the necessary medical attention, and of course a test would be made available to you at any one of our wellness centers.
Oh, great. You mentioned that the impact is on the younger population, but can you tell us what is the risk for the wider population? Although it's affecting the younger population, but what is the risk for the wider population?
Well, the risk remains out there for all. The mosquito does not differentiate between male or female, or I am old, I am young, I am thin, I am fat. Really, there is no differentiation. The mosquito, as Mr. Ragnanan explained, the mosquito lives among us, and if persons are infected, it will bite an individual who is infected and will fly and bite another individual. As long as it is ready to lay and it looks for that blood meal, it will bite an individual. So the risk is there, it is real, it is there for all of us, and particularly those who have had dengue in the past. As I explained earlier, they are more at risk of developing a more severe type. And dengue, because it is endemic, most of us have had at least one serotype of dengue before. So the chance of us getting bitten again, the chance of us getting a second, a third, or even a fourth infection, it is there, and we are all at risk of developing a more severe form of dengue.
Okay, and let us focus a little more perhaps on the public health threat. Let us focus a little bit on the strain on the public health services, and how does that affect our public health services at this present time?
Well, at this present time, being that we are going through the COVID pandemic, and a lot of our resources have been strained. Most of the departments, the units within the Ministry of Health, and I'll speak just for Ministry of Health, has been focused on COVID-19, on prevention, on detection, and on treatment. So with the threat of dengue, with the increasing numbers, obviously this is going to take a strain on our resources, human resources, as well as our lab capacity, because it's the same set of people doing everything. So when we look at our hospitalization rates, to date we've had roughly about 45% of the cases being hospitalized. This is of concern because obviously our attention would be directed towards this. We also have our respiratory hospital that we see persons coming in, getting tested, getting hospitalized for COVID-19 or suspected of having COVID-19. So it becomes a strain, especially on our our public health and our primary care settings when persons come in with signs and symptoms. The difficulty there also is on physicians now having to differentiate between COVID-19 and dengue because, as I stated earlier, dengue really presents with non-specific signs and symptoms, in addition to the fever and the muscle and joint pains, which can be COVID, which can be influenza, which can be leptospirosis. So it presents a strain on our facilities, on our physicians, on our nurses, on all our resources at present when we are all really focused on COVID-19.
If you allow me to respond to that question, we're also looking at the preventative measures, and there's a huge cost associated with getting the chemicals that we're talking about. They wrap up into the tunes of thousands of dollars getting the chemical that we use for adulticide, that is fogging operations. In Saint Lucia, we use malathion with diesel and kerosene, and that is an astronomical cost. Also, we're looking at the livociding, and there is a big cost with that. Even with the cleanup campaigns, there's a huge cost in terms of transportation, providing transportation for collecting bulk waste and working with communities. Developing PSAs, there is a huge cost in terms of publishing and even developing the material itself. So the cost is huge from all fronts, not just the treatment and care, but also on the preventative aspect as well. And then if you look further at the cost, the public health cost, it is not just the mosquito and the sick person, but you have to look at the issue of somebody being unwell. Somebody may have to miss work. A child may have to miss school, and thankfully now that school is closed. But you have to look at all of this to be able to look at the real impact of the disease. So it's actually a very big impact when you put all the figures together. That is why many times it's very, very difficult to cost an outbreak of a disease, because there are so many different facets to it that it becomes very difficult to put a dollar and cents value to the cost. But just to say that every aspect of the response is costly. And now we are in a situation where there is a downturn in the economy. It means that financial resources are not easily obtainable. And as Dr. Francois has said, a lot of our efforts as a Ministry of Health had been towards controlling and reducing the transmission and spread of COVID-19. And it meant a lot of our resources has gone into that area. Now it means that we have to begin to refocus. And it is going to be a challenge to be able to find the necessary resources in-house to be able to address an outbreak of that magnitude.
Thank you. And again, it says that although the Ministry of Health will be doing what is necessary, we also have the community members and persons of the public to play their part as well in this effort. For Dr. Francois, the question is, can you speak on the need for persons to seek care? Because we know with dengue and COVID, the symptoms and the signs and symptoms may be similar. Can you speak as it relates to the need for seeking care, given that persons might be home and they might be treating the wrong sickness?
You really pointed it out. The signs and symptoms are very similar. Right now, as we have noticed the increase, last month we noticed an increase. For the beginning of this month, the numbers have gone down. However, the mere fact that we have the serotypes in circulation, it becomes necessary for persons to really identify whether we do have COVID and what we are dealing with. So do we have COVID only in circulation, and the magnitude of the threat that we have for dengue fever? The serotyping being done overseas plays an important part in our response as well. If persons were not coming in, we would not know that we have 2 serotypes in circulation, and the possibility of us now preparing for severe dengue fever. So there is a need for persons to be able to identify, to differentiate whether we are dealing with COVID. And I want to point out that it's not just COVID as well, because we have other respiratory illnesses in circulation. And when somebody coughs or sneezes, we really need to be able to identify what we are dealing with on the ground. Not every cough, not every sneeze is COVID-19. And it becomes necessary for us to identify what is in circulation at all times. So we still do testing for Zika, we still do testing for chikungunya, because these are things that will become endemic or are endemic in Saint Lucia. So it becomes necessary to then differentiate whether we're dealing with only dengue in Saint Lucia, whether we're dealing with chikungunya, or whether we have other viruses or arboviral diseases in circulation.
Thank you. And if perhaps you can reiterate on the signs and symptoms of dengue. Just reiterate on it.
Okay, so in terms of dengue without warning signs, it normally begins as a non-specific illness. Persons may present very similar to influenza, with a fever, with a headache. What most people, or what is characteristic, is the pain behind the eyes. You also have muscle pain, you also have joint pain, and that too is characteristic of influenza. And you also get muscle pain with COVID-19. So hence the reason why persons need to seek that medical attention. When you get to dengue with warning signs is when you start getting, usually the fever subsides or goes down, and persons start presenting with abdominal pain, with the vomiting, with the diarrhea, with a little bleeding to the mucosa, to the gums or to the nose. And then you have the severe dengue, which is the most severe form, where persons are usually hospitalized at that point and in respiratory distress or in cardiopulmonary distress. And so these persons now may end up in ICU, and there's a 5% chance of dengue infection progressing to that severe form. So these are the different forms of the classification of dengue based on the signs and symptoms, and persons need to pay attention to this because it determines the level of care that you receive. Dengue in its simplest form can be treated at home, it can be managed at home. And so we call on persons to pay close attention to this. What I want to say also is that in terms of dengue, there is no vaccine, there is no treatment available specifically for dengue. So dengue infection, persons are treated based on the signs and symptoms that they present with. So if you're presenting with just the pain and just the fever, then you are treated accordingly. And if you have bleeding, then you are managed differently. So it really depends on your presentation at the time, but there is no specific treatment which can get rid of a dengue infection altogether. It runs its course like most viral illnesses.
Thank you so much. This question is for Mr. Ragnanan. Can you speak as it relates to the safety measures for persons to prevent the mosquito bites?
Importantly, there are things that we can do as individuals to protect ourselves. We've spoken about doing the regular inspections of your premises, but I want you to know that also you need to pay specific attention to protecting your own self. Mosquito nets have proven to be very effective, and we continue to encourage people to use mosquito nets and to use it properly. It means that you must tuck in the ends of the net under the mattress, because if the mosquito gets any space to come in, they'll still come in and bite you. And that's what you do not want. You need to wear long sleeve shirts and socks, and tuck your pants within the socks to protect yourself. And remember, again, we're talking about specific times of the day at home. It's early morning, it's the dawn, and early evening, the dusk. These are the peak times that these mosquitoes come out. There are also times that these mosquitoes will be around all day, especially in dark places. So you need to pay attention even to your working areas, the desk at which you work, and ensure that mosquitoes are not biting you all day. It may very well be one of these Aedes aegypti mosquito. So protecting yourself, there are good insect repellents as well that can be used. You can apply repellents not just on your skin, but on your clothing and your nets as well. You need to explore these. You need to be able to implement basic measures around your homes, as we've said over and over again, and we cannot overemphasize the importance of covering water containers, especially water drums, because we have found them to be the highest number of containers, or the biggest threat in terms of breeding, the water drums. The highest number of containers breeding mosquitoes are drums on the island. And there are basic inexpensive ways that one can do a drum covering and have the water covered. That is very, very important. So these are some of the basic yet important and effective measures that individuals can take to protect themselves against mosquito bite. Because if the mosquito do not bite you, then they cannot spread the disease to you. So that is important for you to do, and also for you to encourage the members of your households to do, to take in these personal protective measures to protecting yourself.
Thank you so much. Dr. Faswa, can you give Saint Lucian a message to Saint Lucians?
Message to Saint Lucians. I think it would be that we need to be aware of our surroundings, that while dengue is endemic to Saint Lucia, while we see cases every year, there is the possibility that persons can complicate, that dengue in itself, although it is usually a very mild illness, there is the possibility that persons can progress to a more severe form. And however, it is preventable once we work together to eliminate breeding, to eliminate the vector that causes or that transmits the dengue virus. We together can decrease transmission and reduce the numbers that we have been recording to date.
Thank you so much. Mr. Ragnanan, your final words. What appeal would you like to make to community members and community groups?
I'd like to say to all of us as Saint Lucians that we are the ones who are majorly responsible for providing the habitat for mosquito breeding. We create the environment and the place for them to breed, live, and grow. And they feed on us as a result. So we all must play our part. We all must get involved. No longer can we sit and wait and let government do it for us. We have to take the initiative. We have to inspect our yards, inspect our homes, and remove breeding grounds that we find. Simple thing like turning over a coconut shell or container will help. We need to take part in community efforts and activities. We all have to be on board. It means that we have to decide today that there are going to be 180,000 Saint Lucians who are vector control officers. That we are going to take the initiative that needs to be taken because it's important in order to protect our own health and the health and well-being of our family members. This is what it redounds to. And this is our appeal to all of Saint Lucian, to removing the breeding grounds and to taking the safety measures that we have outlined. It therefore means that if we can work together as one people, we're going to see great results. And I believe that we can break the spread and the transmission of dengue fever. So my appeal to all is for us to get involved, get on board, and do what we can do. Thank you.
Thank you so much. I want to thank Dr. Michel Fassois and Mr. Parker Ragdanan for enlightening us on dengue and also the dengue situation in Saint Lucia. Thank you so much.
Thank you.
Thanks for having us.
Well, we have come to the end of this live broadcast on the dengue situation in Saint Lucia. On behalf of the entire production team at GIS NTN, I am Fennel Neptune. Thanks for tuning in. Until next time.